Good evening. I'm Dr. Montgomery, and welcome to Montgomery Heart Wellness. And we are coming to you on a Friday evening. A few days ago, a couple of patients and also a friend of mine shared some information about Deion Sanders, and I was shocked to learn that he was about to or may possibly lose his foot. Now, I'm a old football fan. I watched Deion Sanders as a great athlete among many athletes, and I remember him for his great speed and charisma. And the whole idea of him possibly losing his foot was quite shocking. And so I did take a look at some of the information in the news. What I want to do is share with you, first and foremost, I'm going to talk to you about some key aspects of Deion Sanders' condition, and I'm going to give you some medical insights to that. And I want to also share with you some natural ways to improve circulation. So today's topic, we're going to talk about Deion Sanders' situation and the issue of peripheral arterial disease. And I'm going to talk about 5 ways to improve circulation and avoid amputation. Many people in our society suffer from peripheral vascular disease. If you have high blood pressure and diabetes, you are very likely to have peripheral vascular disease, peripheral arterial disease. And if you have elevated cholesterol with either diabetes or high blood pressure, you very likely have peripheral arterial disease. So this information will be helpful to you. And I want you to share this information. If you're new to the channel, subscribe to this because you're going to find this to be very valuable. Let me get into our discussion tonight. And so let's talk about Deion's clinical condition first and foremost. Now, I ran across this article in one of the sports articles, and here it says Deion Sanders may have to get his left foot amputated. And he continues to suffer from blood flow problems. Now, this came from the Colorado football doctors. Also, one of the surgeons, Donald Jacobs, a vascular surgeon, he made the statement that things can cascade. Now, I'm going to share with you what that can mean in a minute. He states that he could lose his foot. They say he's been dealing with issues for some time now. I was aware of the fact that Deion Sanders had 2 toes amputated. There was a big toe and the toe next to the big toe. And I'm thinking this is on that left foot because that's a foot that he's been having trouble with. This was due to blood clots that had run down the leg. I'm going to share some information in terms of what that means in a minute. Now, here's an important piece of information that was also shared in this article. It states that the blood pressure measured near the left foot had been equal to the blood pressure in the arm. It's now 66% compared to the blood pressure in the arm. And of course, it was stated by another vascular surgeon that these arteries could shut down. It's also been noted that Deion Sanders had been routinely dealing with pain. He states that 3/4 into a game, he would have to limp severely. So he had severe pain. This is another important characteristic of peripheral arterial disease. So in summary, Deion Sanders has a history of peripheral arterial disease, 2 amputated toes. Now, they talked about blood clots running down the leg. Typically, if you have a blood clot in an artery, it comes from one of 2 sources. One, it can embolize from the heart or some other part of the body, usually the heart, and it can go to an extremity or some other part of the body. Or you can have what's called a thrombosis. You can have an artery in that leg that can rupture. Those are the 2 non-iatrogenic or non-medical procedure means by which you could have a blood clot. A third means, which is based on a medical procedure, if he's having a stent or some kind of a procedure done, you can have a clot formation at the point where you're trying to do an angioplasty, and that clot can go down from one part of the artery to a distal part. And so those are the 3 possibilities. So those things could happen. The vascular surgeon who said things could worsen or have a negative cascade, he's likely implying that they're probably going to try to revascularize that leg or open it up. And during that process, you can have complications such that, the vessel may shut down. And so you may possibly lose that leg if more blood flow is compromised as a result of attempting to open up those arteries. The other point that was made in this article is that the blood flow in that leg, the blood pressure rather in that leg was 66% of what's in the arm. There's a procedure or test that we normally do in my clinic and other cardiologists and vascular surgery clinics where they look at what's called the ankle brachial index. We call it the ABI. So if you have, diabetes, especially if you have diabetes or high cholesterol, high blood pressure, have your doctor measure what's called the ABI. That's called the ankle brachial index. It's a simple measurement where you take the blood pressure in the arm, you take the blood pressure down in your ankle, and you compare the two. If there's a 1-to-1 ratio or slightly above 1-to-1 ratio, it's normal. If it's 0.9, meaning the blood pressure in the lower extremity is 90% of the upper extremity, it's within normal range, but it's kind of borderline. Below 90% is abnormal. Here's a 66%. So that's an abnormal circulation in the lower extremity, and you want to start doing things to improve that. So these are some key factors. And the other key factors that Deion Sanders has lots of pain associated with exercise. And so this is another characteristic of peripheral arterial disease. So what I want to do is break down the whole concept of peripheral arterial disease and make reference to his condition, since we've used him as a clinical case report of sorts. So what is peripheral arterial disease? What's the definition, causes, and symptoms? Well, the causes, by definition, peripheral arterial disease is narrowing a blockage in vessels that carry blood to the legs, really the lower extremities, the legs, the feet, the ankle. And it's due to a buildup of fatty plaque in the arteries, and therefore narrowing of the arteries is typically what's seen. Now, you could have autoimmune diseases where, like if someone has lupus or some kind of inflammatory disease, where there's inflammation in the artery that triggers swelling. That's not only due to fatty plaque buildup, but also the immune system targeting the arteries. That could also cause narrowing as well. Basic causes typically are poor diet and smoking. And as I mentioned, you can have a disease called, say, lupus or some other autoimmune disease where you can have worsening of vascular circulation as well. But these things are typically exacerbated by poor diet, and sometimes smoking can make them worse as well. So what are some of the common signs and symptoms? Coldness in the lower extremities of feet. Some people have leg numbness or weakness. As Deion Sanders reported, you can have pain, decreased pulse in the legs. The decreased ABI is a sign of decreased pulse in the legs. And of course, as Deion reported, lots of pain and cramping in the extremities. We hear this. Also, the pain can be an aching or fullness-like discomfort, or it can be like nerve pain. So some people with circulation problems can have nerve pain. And the reason for that could be the fact that the nerves leading to those extremities are not getting circulation. And so you have neuropathy-like symptoms, even though that primary cause is poor circulation. Of course, skinny, shiny skin on the legs, so you're not growing hair because hair is not being nourished. So what are some of the treatments? Well, there are medications. We typically use antiplatelet medications, sometimes anticoagulant medications. Cholesterol-lowering drugs, such as statin drugs, are frequently used because oftentimes people have elevated statin. Also, statin drugs theoretically can decrease inflammation. And we also want to improve blood pressure, which is an important factor in terms of controlling any chronic vascular disorders, peripheral arterial disease as well. What are some procedures that are done? Angioplasty and balloon angioplasty and or stent placement. If the artery is too distal and too small, they'll just balloon it. If it's a large enough artery that can take a stent, they'll put a stent in place. There are more advanced therapies such as surgeries. That's either vascular bypass surgery or, heaven forbid, amputation. And that's what Deion Sanders is trying to avoid. So vascular bypass surgery, they'll take a healthy vein and use it to bypass an occluded artery. But unfortunately, some situations will be amputation. And here's a brief gory picture of a leg being amputated. It's a pretty drastic procedure. I'm not going to spend too much time on that. But the point is that there are lots of treatments, standard treatments that we use for people with peripheral arterial disease. However, What are some natural ways in which you can minimize the need for these types of procedures, especially avoid amputation? And I've had lots of patients with severe peripheral vascular disease, and we've used a lot of these natural approaches, and they've avoided amputation. So first and foremost, you want to start with nutrition. Nutrition is going to be the most prominent part of this. And as we go on, if you're getting some information out of this and you're new to the channel, please subscribe, give us a thumbs up, or give us the love, and share this information because it will be very valuable to individuals. So removal of animal protein from the diet is very important. That includes animal flesh, that includes dairy products, and also includes eggs. Now, this is a detox regimen I'm talking about. So this is someone, you've been diagnosed with peripheral arterial disease, you're in a situation similar to Deion Sanders, and you're trying to make things change rapidly. This approach can be effective within a matter of days to weeks. And even if you have to have a revascularization procedure, it's going to improve your chance of an outcome. So this approach I'm talking about can maybe help you avoid needing a surgical procedure or revascularization procedure, or improve your outcome and limit your need for possibly going toward amputation. That's really what you want to do. You want to salvage your limb. Number two is to eliminate processed foods and beverages. Okay, so you want to eliminate all forms of animal protein. Number two, eliminate processed carbohydrates and pasteurized beverages. Okay. Number three, you want to consume only raw plant-based foods. Those are whole fruits, ideally seasonally. You want to have leafy vegetables with a variety of colors. You want to have vegetables with high water content, cucumbers, celery, etc. So you want to consume high raw plant foods. Number four is increase your overall hydration. Alkaline water in glass bottles, preferably, and distilled water. Now, lots of people distill the water because you can remove all the toxins from the water, and you can reinfuse it with plants such as greens, cucumbers, lemon, or add sea salt to remineralize it. And you want to increase your daily fasting window. Now, typically what we do is we have our patients follow a time-restricted eating window from 11 a.m. to 4 p.m. They will consume water before 11 a.m. and water after 4 p.m. And they'll consume just raw plant foods during this time. Sometimes they may do cold-pressed juices between 11 to 4 and water outside of that time. They may do a smoothie feast for some of our patients with weak hearts and peripheral vascular disease. So it allows the body to heal itself faster, and it removes inflammation, it removes oxidative stress, and it allows these arteries to heal in a very rapid fashion. You can also expand that feasting time from 11 to 6 during what's called a maintenance phase. So let's say we do 4 straight weeks of an aggressive detox, 11 to 4, all raw. Then you can do a maintenance phase. You may add some steamed greens to it after that 4-week detox period, and you may eat from 11 to 6 p.m. Either way, your feasting times can be adjusted. Sometimes you may start later and end later. Sometimes you'll start earlier and end earlier. We prefer the earlier start and finish time because that's closer to your physiological feasting time. So in essence, you want to clean up your food and at the same time, clean up your arteries. We want to extend our wishes, best wishes for Deion Sanders and Godspeed for a fast recovery. Again, this is an approach that we have seen work time and time again. Many of our patients who have bad peripheral arterial disease, they follow this approach, their circulation improves. We had lots of patients who can avoid having to go get revascularization procedures, and the ones who require it have a much better outcome as a result of it. We have patients right now who have real bad circulation, and one patient that comes to mind, she has her circulation was really bad. She had a bad toe, and we were able to prevent the toe amputation because even though my individual colleague went in, took a look at her arteries, could not revascularize her. We had on a detox diet, we on an infrared sauna, we did a few advanced things, And we improved that microcirculation to the point that she had excellent wound healing. Her podiatrist was able to go in and shave a small piece of the bone back and cover that up with skin. And we preserved the toe and we preserved her foot, and she's walking around doing much, much better, despite the fact that my interventional colleague could not open those arteries up. So this is a proven method. And if Deion Sanders is listening, we have lots of information on our website, and this simple approach can be carried out. You can go to montgomeryheart.com. You can look at our Jumpstart detox program. It has a lot of these features in it, and it shows you how to do that. So anyway, again, hit the likes, give us a thumbs up, subscribe, and share this with any and everyone that you know. Until next time, see you then.